In order to help illustrate the thoracic anatomy as visualized in the coronal plane at these different probe positions, we will use magnetic resonance imaging to help correlate the anatomy in the coronal plane of cut with the ultrasonographic appearance and orientation of the image on the screen display. Let's first start by assessing the coronal plane obtained when the probe is placed in the posterior axillary line. The resulting coronal plane of cut through the chest is illustrated here using MRI. A CT scan axial perspective of the chest with the ultrasound probe placed in the posterior axillary line is also shown to provide additional information on orientation and anatomy. The main anatomical structures and organs visualized in this plane of cut are the right lung, the left lung, the vertebral column, the liver, the spleen, and the superior aspect of the right and left kidneys. Over the liver will be found the right hemidiaphragm, and over the spleen will be found the left hemidiaphragm. We now add to the illustration the ultrasound probe and ultrasound beam in the area corresponding to the lower thorax and upper abdomen. This is where the probe should be initially positioned when performing an ultrasound examination of the pleural space. Let's focus our attention on the anatomical structures specifically found in the ultrasound beam field of view. For more clarity and better orientation, a small icon showing the area where the probe and ultrasound beam are focused will be illustrated in the upper part of the screen. In order to illustrate orientation of structures in the exact same way as they will appear on the ultrasound system screen display in the cardiology convention, we will need to turn the image 90° clockwise. Imaging based on the radiology convention will be illustrated next.